Hi everyone, thank you for joining me today. My name's Katie. I'm one of the product specialists here at Contra Medical, and today we're going to be going over the frequently asked questions on QiVi. Now, if you haven't heard of QiVi, QiVi is our newest product release. It is a male external urine management device. It pairs with a wall canister and suction tubing to divert and collect urine output. So let's get into the device components, the use of the device, and those questions. So the QiVi consists of 3 different parts. It has the suction tubing on the top, an adhesive patch that's silicone based, and a collection pouch. All of those work together to collect and divert the urine away from the patient. It's a 100% closed system. And again, we're achieving that 100% accurate urine output measurement. The QiVi is intended to be used on male patients who have urinary incontinence who are semi to non-ambulatory. We would want to focus a bit more on the contraindications of the device, so we would want to avoid placing it on patients who have urinary retention, female anatomy, any type of allergy to the materials, and then any type of open lesions, wounds, ulcerations, or inflammation. So let's go into those frequently asked questions that we have and hopefully provide some insight as to how you can use this device in your facility. Yes, so we do need to clean and dry the perineal area before applying the device, and we also recommend using any type of skin prep product. So if you have those readily available, we would recommend using it to just optimize that adhesion and get the best placement possible. This is a tricky question because it's very dependent upon the patient. If the patient has very coarse, prevalent hair follicles, then we would recommend trimming it, but it's not necessarily a requirement for the use of the product. So QiVi can function with the hair follicles in place, but we can kind of imagine those hair follicles as a barrier between the patient's skin and the device adhesive patch. So we just want to remove that barrier as much as possible to get an optimal adhesion. That answer is no. Unfortunately, those would be contraindications of the use of the device. If the patient has any type of skin lesion, inflammation, irritation, those all would be contraindications, so please avoid those situations. Yes, so because it's a 100% closed system, the QiVi can be used in supine, lateral, or even the seated position. As long as we have that suction canister and the suction tubing connected, we can use the device in many different positions. Now hopefully we've answered some of your questions in this video. If you do have any other questions, all of our contact information is available at the end of this, so just reach out and let us know what questions you have. We also have free product available right now for an evaluation of the QiVi, so if you're interested in the product and you think it could benefit your facility, just reach out to us. We can put you in contact with your local rep and get product to you. Well, thank you all again for joining us. We look forward to answering any other questions you may have.